Hi, welcome to MANTHRA Academy online crash course for nurses. Medical Surgical Nursing, Eye Disorders.
If you didn't subscribe Nursing Manthra YouTube channel until now, please subscribe now and enable the bell icon to get the updated notifications.
Part 1. We are going to discuss regarding anatomy and physiology of the eye. 1 inch in diameter and is located in the anterior portion of the orbit. It serves an important function, that is sense of sight. Orbit. What is orbit? It is a bony socket of the skull where eye is located. The eye is cushioned within the orbit by part of fat. There is a lacrimal gland that produces tears which helps in moisturizing the eyes as well as flush away foreign matters that may enter the eye. Then we have the eyelids and eyelashes. Eyelids protect the eye from foreign matters. Example, dust, bright light, debris and all. It will protect. Eyelashes prevent the foreign matter from getting into the eye. Then there is conjunctiva. Conjunctiva, this transparent layer of the tissue covering the front of the eye, including the sclera and inside of the eyelids. Keeps bacteria and foreign matter from getting behind the eye. Conjunctiva contains visible blood vessels. Then there is sclera. The white part, this is sclera, the white part of the eye that one sees when looking at oneself in the mirror is the front part of the sclera. Sclera gives the eye its shape. Extraocular muscles are attached to the sclera, and these muscles helps to look left or right, up and down and diagonally. So this white color, this layer is sclera. So this sclera gives the shape for this eye. So it is attached with the ocular muscles and helps for the looking up, right, down and all. Then there is cornea. This is cornea. This is a transparent clear layer at the front and the center of the eye, located just in front of the iris, which is colored part of the eye. Cornea helps to focus the light as it enters the eye. Then we have iris. This is iris and pupil. This is pupil. So the colored part of the eye is iris. This is a ring-shaped tissue with a central opening called the pupil. So here it is ring-shaped. So it is central part is there as pupil. The iris consists of a ring of muscles which contract, causing the pupil to constrict. Second set of muscle fibers radiate outward the pupil, which when contract causes pupil to dilate. Constriction and dilation of the pupil control the amount of light enters the eye. Then in the eye we have the anterior chamber. This is anterior chamber. This chamber. So anterior chamber or angle, then a trabecular meshwork like that and all. Okay, we are saying anterior chamber lies between the cornea and iris. So this is cornea and this is iris. In between the anterior chamber is there. Anterior chamber angle and the trabecular meshwork are located where the cornea meets the iris. Trabecular meshwork is the area where aqueous humor, that is a clear watery fluid, drains out of the eye. Then there is a posterior chamber. So back side, that is a posterior chamber. So fluid filled space immediately behind the iris. So posterior chamber, fluid filled space behind the iris, but in front of the lens. So in front of the lens, this is lens. So this area we are saying it is posterior chamber. Fluid filled space immediately behind the iris, but in front of the lens. Fluid is the aqueous humor which nourishes the cornea and the lens. Then this is the lens. Okay, lens is a clear flexible structure that lies just behind the iris and pupil. A ring of muscular tissue called the ciliary body surrounds the lens. So here you can see the ciliary bodies that surrounds the lens. Aqueous humor is secreted by the ciliary body. Ciliary body and the lens together help focusing of light as it passes through the eye. Then another structure is choroid. This layer is the choroid. Choroid is the dark brown membrane located between sclera and the retina. So next to this yellow portion is the retina. This white portion is sclera. So in between there is a choroid. Choroid contains many blood vessels and supplies nutrients to the retina. Next layer here you can see that the yellowish color here it is, that is retina. The retina is a visual receptive layer of the eye in which light waves are changed into the nerve impulses. So the light waves will be changing to nerve impulses in the retina. The nerve impulses are transmitted into the optic nerve through the nerve cells. From the retina, it is the nerve impulses will be transferring to this optic nerve. Optic nerve carries these impulses to the brain, where the electrical signals are converted into the recognizable images. Retina has two types of cells. This retina is having two types of cells. That we are saying that photoreceptor cells, photoreceptors, that is rods and cones. Rods responsible for the vision at dim light, do not allow the color vision. That is rods. Cones are responsible for color vision and function at bright light. Then another structure is macula. So this is the macula located at the central part of the retina and has the highest concentration of the cones. This is the area of the retina that is responsible for providing sharp central vision. Then we have a vitreous cavity. So here it is there, okay, vitreous body, vitreous cavity, located behind the lens and located in front of the retina. Vitreous cavity is filled with a gel-like fluid called a vitreous humor. Vitreous humor helps in maintaining the shape of the eye. Then we have optic nerve. So optic nerve, a bundle over 1 million nerve fibers is there in the optic nerve, is responsible for transmitting nerve impulses from the eye to the brain. The area where the optic nerve enters and exits the retina is called optic disc or a blind spot. Then extraocular muscles. 6 extraocular muscles are attached to each eye to move the eye left, right, up, down and diagonally or even round in circles when one wishes. So nerves, cranial nerve 2, that is optic nerve. Cranial nerve 3, oculomotor nerve. Cranial nerve 4, trochlear nerve. Cranial nerve 6 is abducens, enter the orbital space and innervates the extraocular muscles. Then ophthalmic branch of a trigeminal nerve innervates gland, conjunctiva, lacrimal gland and eyelid. Then blood vessels. Blood supply received from the branches of internal carotid artery, chiefly by the ophthalmic artery and its branches, the blood supply to the eye. Blood retained by the superior and inferior ophthalmic veins to the cavernous sinus. Eye is the most valuable and sensitive sense organ and it is a natural optical instrument. It helps to see the beautiful, colorful world around us. So we can discuss about important parts of the eye and their functions. Already we discussed it, but we can see through the animation.
For continuation of this video and more system-wise crash course, feel free to contact Nursing Manthra. WhatsApp number +971 5025 15717. Please check the description for WhatsApp link. DHA, MOH-DHA-HAAD, Saudi Prometric, Oman Prometric, Bahrain Prometric, Qatar Prometric, nclex-rn, CBT exam. We are providing system-based crash course videos. Respiratory system, cardiovascular system, ENT system, ophthalmic system, nervous system, gastrointestinal system, urinary system, reproductive system, musculoskeletal system, endocrine system, dermatology, child health nursing, maternal health nursing,
community health nursing, mental health nursing. Fundamentals of nursing includes calculations, nutrition, research and statistics. Online crash course. Anytime you can study with an internet connection. For reference, you can watch system-based crash course videos in Nursing Manthra YouTube channel. For full detailed crash course video with picture, feel free to contact me in my WhatsApp.